Changes are coming to the way people test for cervical cancer in this province. Earlier this week, the BC government unveiled a new self-screening program for HPV, meaning patients will be able to provide samples from home and get fewer pap tests from a doctor. CBC Health columnist Dr. Melissa Lem joins us now to explain why and how this will make an impact. Nice to see you again for the second time this week.
Thank you.
So, first of all, what are HPV infections and why can they lead to cancer?
HPV stands for human papillomavirus, and there are over 100 different kinds of HPV that are transmitted through close skin-to-skin contact, and they can cause issues like warts and throat, anal, and cervical cancers, which is what we're talking about. And when you get infected with HPV, it's extremely likely if you've ever been sexually active, and in fact, the majority of these infections clear, but the 10% that don't can persist, and within 5 to 10 years can sometimes lead to precancer, and 15 to 20 lead to cancer. And that's why it's so important to keep your screening up to date, and also to get vaccinated against HPV.
And so why is the province transitioning, do you think?
Well, it is in fact based on this monumental change that is based on evidence and access. So when you test for, when you do pap testing, you're in fact looking for the changes that HPV causes to the cells, whereas when you do HPV testing, you're getting right to the root of the problem, which is the HPV that's leading to those changes. And in fact, research shows that it's better able to detect cases, which leads to lower numbers of precancer and cancerous lesions. And in fact, in terms of access, it's making it way more accessible because this testing is free for people in BC who need pap testing. And so I have patients, for example, who just yesterday told me, I'm really excited about this because I'm uncomfortable about coming in for pap tests, and this is going to be a game changer for me. And so I really think the province is a trailblazer in women's health. Last year, it announced free contraception for people, and now this great self-screening. And so it's really going to improve care and also outcomes.
Are there situations where someone should still come and see you and another doctor in case they have a question or a circumstance that they're just not sure about that a take-home test wouldn't answer?
If you prefer pap testing in person, that still is available. And then if you do get a positive HPV test, you then have to go get a follow-up pap test. In fact, my clinic has offered to offer those follow-up pap tests to patients. And also, we have to remember that this is a screening test for cervical cancer only. It's not to diagnose symptoms like abnormal bleeding or discharge or pain. So you do have to see a doctor in person for that. And something else to remember is because we're going to be doing a lot more at-home testing, we might be missing cases of sexually transmitted infections that we would typically pick up during pap tests. So I think it's really important, even though this is a great leap forward in screening, we need to make sure that patients have good access to STI testing as well.
Dr. Melissa Lem, we appreciate your time and your expertise. Thanks for coming in.
Thanks, Dan.